Our panel is Close Rikers, Then What? Ensuring appropriate healthcare and housing for individuals leaving incarceration. And I have the true pleasure and honor of introducing our moderator for this next panel, Darren Mack. Darren is a director at the Urban Justice Center. He's an activist, an advocate, and an organizer. He was directly impacted by the criminal legal system at the age of 17 and has been involved as a leader in the Close Rikers campaign since its launch in 2016. Darren is an alumnus of the Barred Prison Initiative, where he earned his BA and graduated from Hunter College with a master's in social work in 2019. He's also a co-director at Freedom Agenda, a member-led organization dedicated to organizing people in communities directly impacted by incarceration to achieve decarceration and system transformation. Thank you so much for joining us, Daryl.
Thank you so much, Amy, for introducing and putting this together. And I also want to thank our audience members for joining us this afternoon for this phenomenal panel, Close Rikers, Then What? I could say a lot about myself as co-director at Freedom Agenda. We are leading the grassroots work to close the last penal colony in the US, Rikers Island. And before we move on to get started, I would like for our tech to put up this question, this poll that we have. So the question is, in 2021, how much money was spent to keep someone incarcerated in New York City for the year? So we have multiple answers. Was it 180,000 a year, 550,000 a year, 375,000 a year, or 420,000 a year? So while our participants are answering that question, I want to say that, Freedom Agenda, we launched in October of 2020. So we're a new organization. However, although Freedom Agenda is new, our staff and our members have been engaged in the movement to close Rikers for years. And the discussion and attempt to close Rikers goes back actually decades. One example is there was efforts in the past made by the late and great Herb Sturz, who was the deputy mayor for criminal justice in the Koch administration in the late 1970s. But that effort was met with vitriol, fear-mongering, and a reactionary punishment paradigm backlash, and obviously defeated. That was a top-down effort. But in 2016, a bottom-up grassroots movement of survivors of Rikers like myself, their family members, and allies built a coalition that was so broad that it changed the hearts and minds of New Yorkers to understand that Rikers is beyond reform. It's beyond repair. And the only solution for the last penal colony in the US is closure. We have Alcatraz, many of our audience members probably heard of, was closed several decades ago. And McNeil Island, which I believe is in Washington, was a penal colony that closed in the early 2000s, leaving Rikers Island to be the last penal colony in the US. So we have the results from our poll, and the question was, in 2021, how much money was spent to keep someone incarcerated in New York City for the year? So, and 16% said 180,000, 20% said 550,000, 43% 375,000, and 20% chose 420,000. So the answer is, which was actually reported, I believe, within the last week by the city comptroller, we actually spend $550,000 now to incarcerate a single person in New York City for a year. Now imagine what we could do with that money if it was directed in other resources like homes, as Darren mentioned. So through our advocacy and organizing, we pushed the city to adopt a plan to close all 10 jails on Rikers Island and the boat, also known as the Vernon C. Bain Center, which is adjacent to the Bronx, and address conditions of confinement by replacing the decrepit, deteriorating jails in the Manhattan, Brooklyn, and Queens, and a facility in the Bronx. So going from 14 jails across the city throughout New York City down to 4 facilities. From 14, actually 17,000 beds across the city down to a max population of 3,300. So City Council passed this plan that survivors of Rikers and our family members and allies fought for in 2019. And the current cost of running the DOC across in our city is about $2.7 billion a year. At least in fiscal year 2020, that it was $2.7 billion to operate the jail system. But the Lippman Commission, which was a commission that was appointed by former City Council Speaker Melissa Margarito, and they approximated in a report that they have put out that the borough-based plan could cut as much as $1.8 billion in annual operating costs. That's $1.8 billion every single year saved moving forward the borough-based plan. So, and also simultaneously in 2019, the mayor, de Blasio, the speaker, Johnson, and city council, they came to agreement to a wide range of investments tied to the closure of Rikers Island, totaling $390 million, including it was $126 million previous planned investments and additional $265 million in programming, for new programming that will address the root causes of incarceration and help reshape New York City's criminal justice system. So Freedom Agenda has picked up the baton, and this year, after years of organizing and advocacy, criminal justice advocates and organizations, along with environmental justice organizations and advocates, push for what is known as the Renewable Rikers Act, which is a trio of legislation that was passed by City Council, signed by the mayor. It's a law that establishes a process to transfer the control of Rikers Island from the Department of Correction to the Department of Citywide Administrative Services for sustainability and resiliency purposes as the jails close. And for the first time in Rikers Island's almost 100-year history, land and a facility was transferred in June. And another aspect of one of the trio of laws is that there's a law established that will require New York City to determine the feasibility of what renewable energy and large-scale battery storage can be sited on Rikers Island as part of a long-term energy plan. So basically, New York City is going to be able to assess the capacity for like organics and wastewater process on Rikers Island too. So there's a lot with this Renewable Rikers Act, because right now, in specifically communities of color and low-income communities, there is what is known as peaker plants in these communities, and it was supposed to be temporary, but they've been there for decades. And these peaker plants, basically, when the city utilizes a certain amount of energy and these peaker plants kick in like batteries so the city won't black out. But the problem is that these peaker plants exhume a lot of toxicity into the atmosphere. And so what the Renewable Rikers vision would do was create the sustainable green energy on Rikers Island and remove these peaker plants from these communities and create it'll open up space for whatever the community want, whether it's a park, whether it's affordable housing, whether it's whatever the community needs in that space. So we have a long fight ahead of us, a lot of work to do around that. And we cannot get to Renewable Rikers until we close Rikers. So in order for us to remove this moral stain of Rikers in our city, we need the city to move forward with these plans, pulling several levers at the same time, like decarceration, addressing the roots of the root causes of incarceration, like health, non-carceral responses to people with mental health and substance use challenges, and housing, or as Darren McGraw stated, homes. So with that, we there's a lot to discuss about the need for services that these panelists I'm going to be bringing on will be offering, and we'll get right into introducing our panelists. So first up, we have Christina Green. She is the director of Health Justice Network. So Christina Green began working as a community health worker at the Osborne Association for the Health Department's NYC Health Justice Network, and is now the director for the program. The NYC HGN, which is the Health Justice Network, is an innovative reentry program to support individuals returning to the community from incarceration with health and social services. Formerly incarcerated herself, she is an avid speaker and advocate for persons who are justice impacted, specifically those in substance use recovery and survivors of trauma and trafficking. So welcome, Christina. Thank you for being here today.
Thank you so much. You gentlemen are hard acts to follow. I will tell you that.
We trying.
Well,
so we also have Anna DeLeon, Associate Vice President of Housing at Fortune Society. Anna DeLeon is the Associate Vice President of Housing at the Fortune Society. Anna has master's degrees in criminal justice and public administration from CUNY's John Jay College of Criminal Justice and an MSW in social work from the Hunter College. In her work at the Fortune Society, where all clients have touched the criminal justice system in some way, she focuses on improving access and connection to quality and consistent healthcare and stable, safe, secure housing. She now oversees a portfolio of scattered site housing for individuals with various disabilities and a new seniors housing congregate program in the South Bronx for individuals 62 plus and over with histories of criminal justice involvement. So Anna, welcome to the panel.
Thank you so much. I'm happy to be here.
And we also have Jerome Green. Jerome is a community health worker with correctional health services, working at the point of reentry and transition at Kings County Hospital in Brooklyn. Through his personal experience, he understands why clients are skeptical of coming into hospitals and works with them to overcome those barriers. Jerome is also a certified recovery peer advocate. Welcome, Jerome.
Thank you. Thank you all.
And last but not least, we have Yolanda Johnson-Peterkin. Miss Yolanda Johnson-Peterkin joined the NYCHA, which is NYCHA, in 2015. Her current role is Chief of Housing Community Activities. She is committed to implementing systemic change by reunifying formerly incarcerated people with their families. Prior to her current role, Ms. Johnson-Peterkin was the Director of Operations for Reentry at the Women's Prison Association. She has received honors from the Correctional Association of New York, Citizen Against Recidivism, and the NAACP. Welcome, Yolanda.
Well. So they did bring fire to the table. I got something for that, Darren. Yes, everybody. So glad that you're here. So thank you so much, Darren, and thank you so much, Amy and Harmony, for inviting us. But we are ready. Don't worry about it, ladies. We got this.
Awesome. Yes, I know we got this. So basically, we had a lot of questions for our panelists, and we asked each panelist to talk a little about their program, what they do, barriers clients currently experiencing accessing housing and healthcare. So we want to get started, take 3 to 5 minutes. We want to get started with Christina. So Christina, can you talk about your program, what you do, and the barriers that clients currently experience accessing housing and healthcare? So
I'm waiting for my video. Hold on a second. Okay, here I am. Yes. Thank you so much for the warm welcome. So I'm here about a program that New York City Health Justice Network. And I will say, to start off with, because everybody was so transparent, I too am formerly incarcerated, and I also am in recovery. And this is a program that I'm very proud of. So we've done a lot of great work. It's needed services throughout New York City, and I can say that because I am part of that community. So I'll start by saying the New York City Health Justice Network, our aim is to improve the health and well-being of persons returning to the community from incarceration. So far we've worked with over 850 participants since enrollment began in September of 2019. We work with participants trying to address their goals in reentry, giving them the tools in order to be successful by providing a collaborative approach of partnering with the health department and community organizations. In our network, as you can see on the screen, we have 3 reentry organizations that target justice-impacted populations: the Fortune Society, the Osborne Association, and Harlem Community Justice Center for Court Innovation. We also have 3 federally qualified healthcare clinics: Community Healthcare Network, the Institute for Family Health, and Sydenham, New York City Health and Hospital System. We have a team of 6 community health workers with lived experience of the justice system. Each one is embedded in our 6 partner sites, providing resources and services and working hand in hand with our participants, helping them navigate the obstacles of reentry and providing much needed peer support. So our services are completely voluntary. We are anti-racist and trauma-informed in our work. The network has a community advisory board made up of past and present participants who meet with us quarterly to give us insight to the needs of our population. Because like he had spoken about before, that all these other entities are given advice, but we go right to the source and we say, what do we need as a group? How do we address this? So we also have a community of practice, which is made up of partners that also meet quarterly, where we share information and continued learning for best practices in our program moving forward. We are grant funded by the District Attorney's Office of New York Criminal Justice Investment Initiative. Next slide, please. Okay, so persons returning home have to navigate a lot of competing priorities. So finding employment, housing, reunifying with family, completing parole or probation requirements, ongoing meetings, regular drug testing, completing mandated programs, drug treatment, and mental health. So all this in conjunction with family, and let me find it, there's just a lot. So you could go on to the next slide. Okay. So incarceration has been associated with a number of adverse health outcomes. So criminal legal system involvement is a public health issue for a number of reasons. In this slide, I'd like to highlight a few. So premature death. So the risk of mortality increased 12-fold in the first 2 weeks of release from incarceration, almost all of it from overdose deaths, followed by cardiovascular disease. Chronic diseases, 40% of incarcerated individuals have at least one current chronic medical condition like heart disease. Cancer. Incarcerated women have higher rates of cervical cancer, and incarcerated men have higher liver and lung cancer mortality. These are really scary things. Trauma and behavioral health. 50% of people in state prisons and 60% of people in jails have a diagnosable substance use disorder compared to 9% of the general population. So these are really, they're scary statistics. Next slide, please. Okay, so who can participate in this program? So anybody that's a New York City resident is 18 years or older and has come home from incarceration within the last 3 years. So that's Rikers, that's state, that's federal prison. So we don't ask what their crimes are. We're not concerned with that. We're here to help them navigate their reentry. I want to make that, and we're again completely voluntary. So I think that's makes a huge difference to a lot of the other programs. Next slide, please. Okay. So I also have the social determinants of health wheel. So here I'd like to cover how the Health Justice Network addresses the needs of participants returning from incarceration. On the left-hand side, you'll see the CDC Social Determinants of Health wheel. And I'd like to share with you some of the ways that the Health Justice Network continues to address these determinants. And you spoke about these, a lot of these determinants in the earlier presentation. So some of the services is access to health, dental, specialty care, mental health and substance use services, SNAP and benefit enrollment, employment, vocational and career development, educational services, legal support, and referrals to housing support services. We have seen an increase in referrals for people in need of services, including people being released without any vital documents or refills on needed medications. We've been able to purchase birth certificates and assist with remote services through the Social Security Administration, applying for replacement Social Security cards, and setting up Department of Motor Vehicle accounts to establish identification for our participants. So especially through the COVID-19 pandemic, we've seen a whole bunch of people released with no I-9 documents, no medication refills, no access to cell phones, anything like that. But we were able to purchase cell phones for participants to encourage, social connectedness, allow for telehealth visits, medication refills, primary and behavioral health services. And with access to smartphones, our participants were able to enroll in the workforce development classes online, educational classes, legal services, and now everything's online employment applications. And a lot of our participants coming home after long incarceration periods, there was a time where you could just turn in an application, walk into a place. Those days are over. So we were able to do that. Our community mentoring and peer support, including technical assistance, which we found is in great need, to online platforms such as job applications and Zoom. So we reached 75% or more of our participants within the first 90 days of release. And our participants range from very short incarceration periods to several decades. And we're able to work with them all on an individualized basis, as all of our participants have very different goals. Okay, next slide. Okay, so these are our preliminary findings. So the top social service need that we've been able to address our peer support. And I will say this, you know, when we talk about their needs and their goals, when people return home, oftentimes they don't acknowledge that they need peer support. And then we find out after working with them, you know, mentoring, peer support, and then we're like, wow, I really enjoyed this conversation, talking to somebody who's been through the system, somebody who understands that I have, you know, all these financial obligations and my children need, you know, my children's mother or, you know, father may need all this assistance, and I have all these, I have to go to parole and probation, and how am I going to get this pass from the halfway house and get a job? You know, these are real obstacles for people, and I think that we need to all be aware with them. And being that we're all aware of them, the people, myself and everybody that works with the HJN, I think it makes it a lot easier. So the top healthcare needs are primary care, health insurance, health promotion, education. So including COVID testing and vaccinations, mental health, dental care, and substance use treatment. Primary care has been the top healthcare need addressed, and we've been really successful in connecting participants. It is often the segue to mental health and substance use treatment. It is a priority for the HJN participants to develop an ongoing relationship with their healthcare provider. And through the COVID-19 pandemic, we see an increased need for peer support among our participants. So I will say that there's much more increased need for that. Next slide. So that's, I don't know if there was any questions.
Yeah, so thank you so much for that presentation. So what we'll do, we'll give the other panelists a chance to talk a little bit about their work, and then once that we're done, and then we'll dive into, we got a whole heap of questions, and we have some questions that just put inside the Q&A from our audience as well. So Anna, let's bring in Anna here, and you know, talk a little bit about, you know, the work that you do, and the program that, you know, you provide, and you know, some of the barriers that clients that currently experience access to, you know, housing and healthcare.
Sure. So I just want to say that everything Christina just said, we suffer as well. So thank you, Christina, for all of that great information. A majority of the newest program that I'm overseeing is our senior program in the South Bronx. And we're partnering with Bronx Pro Group, and we have 57 of those units for seniors 62 plus, who all have, some of them have very extensive criminal justice connection. And some of them have, you know, were incarcerated for a few days or, you know, even less. So as long as they're 62 plus and they have an additional disability, such as mental health or a history of substance use, it could even be a physical disability, they're in the shelter, they are eligible for housing at Bronx Pro. Unfortunately, we are onslaught with the number of referrals, as you can imagine, for those 57 units. So we have about 120 applicants for the 57 units that all qualify. So it's really a matter of getting all the documents in and getting all the process done. And while we clearly want to house all of them plus more, it really is like a race to the finish line, unfortunately. And what's very troubling is that what happens to the remaining folks is that they're still going to be in the shelter, and they're going to be 62 plus, and they're going to continue aging in the shelter. So our goal in bringing at least these 57 folks into our new housing is we are providing a registered nurse on site, and she can provide basic, you know, medical care, diabetes screening, some mental health screening. We'll also have a licensed clinical social worker on site as well for the tenants. And we are developing massive community connections for them as well. We have 15 case managers for the 57 tenants. So the caseloads will be small enough so that we can make sure that they access services. We'll also have a driver. which is something new for us, a dedicated driver, so that we can make sure they get to their appointments and they get to whatever community services they need to get to, as well as a recreation specialist, which is, I feel, key as a clinician, getting folks out of their apartments, getting them back into the community, making them feel like they're part of the community where they haven't felt like that for so long. We want to make sure that they know that the community is theirs as well. So that was a big deal for us to make that part of, to include transportation as well. So that's our newest program. And so far we've moved in 14 people. We hope to move all 57 in by probably mid-January. And then, of course, there's the affordable units that Bronx Pro will be moving in, and those folks will start moving in January too. The goal with any integrated housing model is that every tenant is the same. We don't want our clients to feel like they're any different than anybody else. This is their home, their gym, their backyard, their facilities, just like everyone else's. And we make sure that we don't put them in a certain place in the building. They're just, everybody's mixed up all across the building, depending on their needs. All of the units are ADA accessible. They all have grab bars. All of our folks have come to us with some level of physical need. Either they walk with a cane or they walk with a walker. Some of them will deny it, and then I'll see them on the sidewalk and they have their cane. And I'm like, that doesn't exclude you. It's okay. So we want to make sure that they feel welcome and secure, and that nothing is going to keep them from getting their apartment. So that's our newest project. We also have other programs that offer housing, not enough, of course, because the number of people coming out of jail and prison who don't have a place either safe and secure or even a family member to go to temporarily are huge. The biggest number of calls that we get are referral calls for housing. And the majority of them are either couch surfing, or they've been in the shelter system for extensive periods of time, or they just don't meet the criteria, because as we all know, jail days don't count toward homelessness. Although, how does that make sense? I don't know. I can't explain that. If you spent 20 years in prison, you're homeless, and that should count. But unfortunately, if the homeless chronicity is an issue for any housing project, and you've been in for that long, or even a year, you don't meet the criteria. So getting around all the regulations and the policies and such is really tough. And we work really hard to try to find matches for folks. The other issue and the big barrier that we have found is that even though we do direct people to Housing Connect, they might get chosen for one lottery or two or three, but then once they put their application in, a big majority of them get rejected because of their charge or because of the amount of time that they spent incarcerated. So then they're back to square one. They're either back to family or on the street even, or back to the shelter. So there are a lot of barriers to housing, and there, even with all of the new housing projects that are opening up recently, it's not even close to meeting the need. So all of that $550,000 that just blew my mind that we spend to keep one person incarcerated, think about how many homes that could provide for someone, and how many new buildings that could renovate and give people a safe, secure place to live. It's very sad that we choose to spend it that way. But I hope we're making a little bit of a dent. And our other housing programs, we have smaller ones with emergency housing, transitional housing. We have a new program called Freedom House as well that has 38 beds for 18 years and older for males exiting the criminal justice system. That's also transitional. And those staff have the same challenges trying to find out what's next after this emergency transitional housing period is over. Where are they going to live then? Because it's not permanent. So we're working really hard. We have a new affordable mixed building coming up on 123rd Street as well. We just broke ground, so that's going to be a couple of years probably. That will also be for folks coming with some touch on the criminal justice system as well, as with all of our services. So that's pretty much what we're working on now. Housing is definitely our focus, and we intend to keep it that way, but we also provide, wraparound services as well, employment, mental health, and we try to engage all of our folks that are in our housing programs in those services to stabilize. Thank you. Thanks for the opportunity.
Wow, that's awesome. Thank you so much for sharing that. And every time I hear about the new senior housing project, I get excited because I know about the amazing work, that Fortune does with the castle, and it's been a huge success. And
Yes, yes.
see
Thank
projects like this growing and developing is like exciting because there definitely is a need.
you.
And
Yes,
shout
definitely.
out to Patricia Hernandez, who I see in the chat, from we that been teaching me a whole lot about the housing issue here in New York City and the challenges that we face, and we're fighting together to increase the projects like that Fortune Society is leading. So thank you. So we want to move on to our next panelist, Jerome. So Jerome, could you share basically more about the program that you're working with, what you do, and like some of the barriers that clients are currently experiencing accessing housing or healthcare?
Yes, thank you. Thank you. And good morning all, and thank you for inviting me to this panel. My name is Jerome Green. I'm a community health worker at CHW with the point of reentry and transitional clinics called PORT. PORT is a health and hospitals program created by the Office of Ambulatory Care and CHS, Correctional Health Services. Our clinics are based out of Kings County Hospital in Brooklyn, New York, Bellevue Hospital in Manhattan. Primary care departments. The PORT practice was established to assist clients upon their release from New York City jails with the continuity of care in mind. For many clients, release, their only contact with the healthcare systems have either been while they were incarcerated or in emergency rooms. One of PORT's primary goals is to link our clients with primary care doctors whom are familiar with our patients' unique struggles and special needs. The transition to routine care can be intimidating and confusing for most. Myself and other CHWs with this assist with this by meeting with clients and gaining their trust by being consistent and available in a variety of ways. One, with helping clients figure out their healthcare goals and listening, which is very important. Asking basic questions. When was your last dental appointment? I've had clients come and I ask that question. They haven't been to a dentist in 15 years. I ask clients when they've had their last physical. Why are they squinting? When's the last time they've been to the ophthalmology department? Why are they limping? Two, with identifying obstacles that prevent the client from keeping appointments, which is appointments, because we can ask clients and schedule appointments, but I think it's very important that we work with their schedule as best as possible. And creating a success plan for our clients to be successful in regaining, how should I say, their balance after release with their healthcare being primary. And that's all I have for that aspect right there.
Yeah, thank you so much for sharing that. We have definitely a ton of questions about the work the amazing work that you do and the services that you're providing. And yeah, thank you for sharing that. So moving right along, we got Yolanda. Can you share, about the amazing work you do? I know Yolanda for years. Her hands is in a lot of stuff, but we focusing on just one thing here this afternoon. The work you do with nature, and yeah, take the mic.
Well, once again, I want to say thank you, and to you, Darren, and all of our esteemed panelists. And there's some background people that we need to shout out as well: Amy, Harmony, Tess, Daryl, and we just want to make sure that we know that this is not just put together and we all just clump together. We kind of like think about this thing here. So everybody, many people know, not everybody. Don't forget Bonnie too. Bonnie's also, shout her out. We thank you guys for this opportunity. It seems that New York is resource rich, doesn't it? Yes, because all of you are doing something around something with something. And we got the other brother out there doing it in Connecticut. So, but yes, we still have more work to do. So I am Yolanda Johnson-Peterkin, and I work for New York City Housing Authority. And what I do is help individuals who have justice history move back into public housing. Yes. So you may call it the projects, and I really implore you not to do that. It is a housing development where individuals live, and if they've done something that they're not so proud of, we then asked them to fill out an application with one of our 11 partners in this work. Fortune, of course, is one of them, Osborne, and all of the heavy hitters, Exodus, CCI, CCA, ABC, ED, no. And so we will send you out that information after this day is over. But if you have someone who's done something they're not so proud of and they want to live in public housing, they can apply. 3 years or less they've been in the community, or they could be currently incarcerated and want to live with their family member, mother, father, sister, brother, immediate family member, adult sibling, grandmother, grandfather. Now, just so you know, you heard it here from me. They can't live with their boyfriend, their baby daddy and baby mama. They can't live with their auntie. And it's not because they have justice history. It's because it's New York State's rule. Because if we allowed all the aunties and stuff like that, we probably have a whole bunch of people. As you know, there's 700 and something thousand people closely, remotely close in public housing. So if a person wants to live with their partner, they can go get that domestic partnership and they can just go right ahead. It's better than the wedding. And so just $30, you go down there and get that. And we accept domestic partnership. So we've been doing this for about 7 years, many of you know, and we have been able to reunify 185 families in the 7 years. And of that 185, only 5 of them have been did something that they may not be so proud of again. So it's obvious that if you give someone an opportunity to live with their family, family takes care of family. And now don't forget, I've heard a lot of comments around housing and what we should be doing. And I know that I saw some comments about supportive housing, but we're talking about New York City Housing Authority. We are a landlord. So we allow the professionals, you guys, to do the work. So all we do is make sure that that family is cohesive. They can live 2 years. The rent does not go up for the first 2 years. Bang, bang. And if they choose after the 2 years to join the lease with their family member, they can. Please understand, everybody dreams that that program is young folks. Oh, they got to be 18 and 19. No, our average age is actually 30. And so individuals want to move back. Sometimes they stay, sometimes they don't. There's no penalty if they want to move out and get their own apartment, or, you know, move in with their other family members. It is no penalty. But we do know that the program is a success. And I know that you guys probably think it's because of me or Sarah, my partner, who works on this program as well. But I'm going to tell you, it's a little of that, but it's a whole lot of family takes care of family. So coming from Women's Prison Association and etc., we would have thought that we'd have to do some social work or find some metro cards. That's not what we do. We are a landlord. We will assist them. Many of them are working for New York City Public Housing, New York City Housing Authority. And so, but they have done that on their own. We have connected them, of course, to the opportunities to work for NYCHA, but the bottom line is that family take care of family. I haven't gotten not one call in my almost 7 years in the middle of the night for a box of cheese, or something to eat. I mean, they call me because we Yolanda and Sarah, but, you know, not because we need to provide any services. Although New York City Housing Authority does have social workers and we do provide services, but yet we connect them to you for that real service provision. And we are excited because as you know, well, as Amy and folks know and Darren knows, we are changing our front door policies. So you guys have given us your feedback. We took all, you know, we went out to the community, to the people who live in public housing, and we said, we noticed that we might have a little time that you get one of those letters or say that you can't live with your family members. Please do not screen out. Send us that information. We want to have some conversations with families about that when they have an exclusion. I know some of you are like getting a knee-jerk reaction to exclusion, but our front door policy means that somebody has applied on the list to have their own apartment. And sometimes once they've done that, they'll get a letter that says, oh, you did a crime in, you know, whatever year that was. And so the person kind of tossed the letter and says that public housing won't let me live there. That's not true. And it has never been true, because on that letter, and you'll find in 2022, it'll say huge, call the Family Reentry Program. On that letter, it says that you have every right to call in and discuss whether or not you have away from doing something, whether or not you have some circumstances you want to talk about. And now that is going to be at the forefront of individuals who apply through the front door. Now, let me just say this clearly, okay? I want you to hear me and hear me clearly. There is no provision that separates individuals who have justice history from the regular person on the list. So a person who doesn't have justice history. Everybody is waiting 3 to 5 to 8 to 10 years to get into public housing, just so you know. And some people have a myth that there's some special list that they can get on and hurry up and get in. There's no special list unless it's a list that has been discussed with powers greater than us. So the list is long, and it's because it's New York City. Because we've been to public housing over there in Arkansas, and guess what? Get an apartment just like that if you want to move to Arkansas. The list is long because it's New York City. Housing Connect list is long because it's New York City. So please keep that in mind. If you have anything you want to talk about justice, please give Family Reentry a call. We will discuss and tell you the hard truth about what is happening with your person. And we are proud of the fact that we're changing our policies for the front door. Somebody is on that list, they come, we'll have a discussion with them, and we will decide whether they can go right ahead and move forward with their application. So NYCHA is proud. You don't hear about this on the news, but we do have entities that is working towards making sure that we have a fair system and a system that is able to assist individuals who have justice history. Deuces.
Thank you so much, Yolanda, for that. And you made me think about how, like, I grew up in the NYCHA housing. Shout out to anybody from Barrick and Plaza, you know, in the, what I call it Bushwick, but for some reason it changed to like East Williamsburg at some point. But yeah, and my brother, you know, who impacted by the system, he was paroled, you know, and this is like the 80s, and it wasn't really no problem. And I guess like the pendulum swung where it became a huge obstacle, you know, prior to the launch of the work that you do. And that's why I'm so glad, like, since you've been on the ground doing this work to reunite families, you know, it's been much more smoother for people, you know, formerly incarcerated people to return to their families and homes. So thank you, you know, for that work. So we have quite a number of questions, and we have quite a number of questions in the Q&A from the audience. But I want to go first with Christina. So Christina, like, you know, you mentioned about a lot of things, and when you spoke, I was thinking about my personal experience coming home and some of the barriers that I faced. And even though I had a really, really smooth transition, you know, back into society, there was still some barriers. Like you mentioned about like the documents that you help people get for like the ID thing, and that was a laborious, time consuming for me, you know, with my experience. And you mentioned about like peer support, you know, the importance and value of peer support. And I wish I had a peer like in my transition and coming out, because it would have been, I would know how to navigate these systems, to like to get ID, to go to HRA and to get on public assistance, you know, the housing situation, etc. So, but I want you to speak a little bit about like what have you found to be one of the biggest barriers to helping clients get connected to the services they need?
Well, I will say one of the biggest barriers is people coming home without a support system. We've had lots of people after several decades of incarceration, some of their family has passed away or moved. The world has changed after 30 or 40 years. So to come home and things that we take for granted, like riding the train, using a Zoom on a Zoom meeting, like we talked about the applications, even using a cell phone. These are big obstacles. So I will say the lack of support, and sometimes the community health workers is the only support system that some of our participants have. Mm-hmm. So I will say that's, for me, that's huge. Another obstacle was the identification, the I-9 documents, or being released with a AKA. So if you're arrested under another name and then being released with your prison release papers under another name, like these are huge obstacles to get your birth certificate changed, all these different things. But we've been able to navigate it, with the lack of, I see people coming, they don't have a cell phone. How, if probation is asking you to get a job and to report to them, and you don't have a cell phone, you have no support system, you're living in a transitional hotel, how are you supposed to do that? So a little thing like offering a cell phone and minutes for somebody could really change their lives.
Wow. Yeah. Thank you for sharing that. So we want to stick with barriers, Anna. So barriers, can you talk about some barriers of people like leaving incarceration and accessing affordable and permanent supportive housing? Because it was actually just yesterday. Yeah, yesterday I was at action at City Hall, fighting for the Fair Chance for Housing Act, which is an act that to end the legal discrimination of people that have past convictions from housing. It's actually legal in New York City to discriminate against people access to housing. Once they see, if you have an application, they see that you have a conviction, they could just throw it in the garbage and say, we don't, we can't rent to you. And
Right.
It was a guy on the side, like a passerby, who was like, he had an issue with housing. He was formerly incarcerated, and he was like staying at people's houses, and he had a voucher. And I believe the voucher, and he was like, saying, hey, how did this act is going to help me? This voucher is going to run out. That's kind of some of the barriers that people have. Like, so could you talk about like those barriers that people have?
Sure. So having the voucher, I've found more and more recently, because folks in the shelter that get the City FEPS voucher, but that's the very, very first step. We recently housed someone in our scattered site program who had been in the shelter. I think he was in the shelter for almost 3 years, very sadly. Young man going to college in the shelter, and his caseworker reached out to me directly and said, I heard you were at Fortune. I know that you've been working in housing. I have this person here. He's going to college. He's got a City FEPS voucher. And I said, well, that doesn't do any good for our housing programs, but send me his information. So she sent me his 2010 housing packet. And it turns out that he had the chronic homeless designation. We took him out of the shelter, put him in our Shelter Plus Care program, did not use the City FEPS because we get OASIS funding for our Shelter Plus Care. So it just makes me wonder, though, how educated, and not taking anything away from the shelter staff, I know they work really hard and they work with us beautifully, but how much do they know about the qualifications for certain supportive housing programs? Because this gentleman was in the shelter with a mental health disorder for almost 3 years after being incarcerated for 5 years. Now he was in college and he was eligible for this program for almost all of the last 2 years, yet he stayed in the shelter. So until they reached out to me directly, and I looked at his housing packet, and he was chronically homeless, but no one sent him on any housing interviews. So education is one of the barriers to make sure that we as workers know what's available and what people need to do to qualify. That's number one, because if the more people we can get out of the shelter system into whatever kind of housing it may be, the better for everyone, and the more people will thrive and the better they will do, clearly. And the other barriers are, of course, like I said before, the Housing Connect is one resource, but we have actually hired a housing advocate full-time, and his sole job is to help people who are facing housing discrimination. So he will talk to them, but what he's finding is that even if you're chosen for one of the lotteries on Housing Connect, once you fill out that application and you put down that you served 10 years or you served whatever, and my charge was A, B, or C, right away, you don't get a call back. You don't hear from them. You're lost. And then once they do reach it back out to you, if they do, all the beds are filled and the lottery numbers are taken. So there's still that level of discrimination, even through Housing Connect. There are lots of landlords in Housing Connect that don't do that, but there are lots that still do that. So that's another huge barrier. Another barrier is that people just don't know how to go about getting housing. They have no idea how to apply. And that's a big part of what we do. We educate people from the time they come in our door in our intake department, that almost everybody says, do you have housing? Do you have housing? And we have very limited number of beds and we have a few scattered site programs and they're always full. And as soon as there's a vacancy, there's that next person waiting for that vacancy. So we make sure that we screen really closely everyone that walks in the door to make sure that we know which program they could potentially fit in. So in case we have a vacancy, we already have somebody to put in that bed instead of them just languishing in the shelter system for so long and then having to go through that process all over again. So I could go on. There's so many barriers, but finances, not being able to get a job because of your incarceration history is huge. Not making enough money to pay rent is another issue. You might get a job, but you're not going to pay New York City rent on $15 an hour. So it's really hard to refer people to housing that they can actually afford and eat and pay bills. So there's a lot of barriers. Education is first and foremost.
Yes.
On our end, we need to know how to place people and where they can go.
Yes, I agree. And thank you for sharing that. And like you said, there are so many barriers, and that's why we have to work, advocate, and organize to basically dismantle what I mentioned yesterday at this rally for Fair Chance for Housing, that it's a new Jim Crow policies and practices, basically.
Right.
And we have to dismantle, those policies and practices that legally discriminate against people who are impacted by the criminal legal system. Correct. So Jerome, let's bring Jerome in. So I want to ask you, as a community health worker who, what makes you, well situated to help your clients in their reentry process, as opposed to like a doctor or a nurse?
I think what makes me unique for this job is because I want it. I can work several different places, but I chose this because I see there's a serious link. How should I say? When you speak of barriers, I think the biggest barrier to our clients, our patients, our communities coming into these hospitals is trust. I think that there's a serious lack of trust with institutions, systems, period. But speaking on the healthcare system, I can remember young, I was thinking about it yesterday while I was preparing for this. And I was like, I never went into a hospital. The only time I went into a hospital was if I was really hurt. But in terms of going to get, my proper dental care, getting physicals, when I saw a hospital, I saw like, I'm not going in there. And this is nothing was done to me personally, but it's just the stories that came out of, you might have somebody that went into a hospital, for a foot injury and left with no leg. It's a myriad of, it's a lot of issues why people don't go into hospitals. And my job is to break down some of those trust issues. I'm the go-between the client and the doctor. When clients come to me, the first thing I ask them is, what do they need? And how can I help them? Off of that, I ask them, basic questions like, when is the last time you've been to the doctor? How are you limping? All of the, it's in the client's hands. And by the time I'm done with the client, after I regain some basic trust, then I bring that information to the doctor, we have the conversation, and then the client sees the doctor. Trust isn't established until I say and do the things I say I can do. And that's how that process works, because our clients have been, they've had 10, 20 case managers. They've been through all of the, sign this, you go to this program and, you can't get in contact with the case manager. So it's just a matter of just building that foundation of saying, okay, this is what I can do. This is what I can't do. We're going to work on a plan to help you. And it's just basic. It sounds like far out, but it's basic. I treat every client like they're a family member, very patient. kind, caring. I want the best outlook for them. And I want to see them grow. We have clients that come to us, and the first option for us, the information is shelter when you don't have a place to go. Guess what? A lot of our clients have come through and they have keys now to an apartment. 9, 10, 12 months later. I get a lot of calls. I went through the process. It was shaky, but now I got an apartment. My first place, but not only do I have an apartment, but I have doctors that care for me.
Congratulations.
It's a work in progress. Some clients, they don't stay. They go to other doctors. They move, but they've had a chance to work with the port practice. And like I said, we help. I think a serious barriers that we have is we get past the trust. We have to get this ID. We have to figure this out. How, when somebody is released, to get them a proper piece of identification and a cell phone. Because you can't move around, you can't really do anything without that. Those basics, and $550,000, and we got people leaving out every day and they don't have these 2 basic items that they need. So those are some barriers.
Yeah, thank you for sharing that. Because like you mentioned about like hospitals, like kind of like this lack of trust with hospitals, and I think it's also like, I know like at one time I used to have this mindset, I feel ill, I'll just get over it, drink water or take a, and not really get a checkup, and especially, and that's something, especially like for men, Black men, we need to really educate people more about like getting those annual checkups, especially if you like, getting up their age, for the past couple of years, especially during the pandemic, a lot of young people like Chadwick Boseman, passed away. He had cancer. Just recently, a fashion designer, a young man, 41 years old, Virgil Abloh, he passed away, and that's something that I've been like, when I see things like that, like, man, we need to really be starting getting our health, in order and take advantage of the healthcare system and getting these annual checkups, because people are passing away like too young and not getting those checkups, so to prevent, a lot of the things that we could prevent if we had those annual checkups. So thank you so much for sharing that and the work that you do. So we're going to go to Yolanda. Yolanda, so could you tell us like what changes you would like to see at NYCHA to better serve family and community members post-incarceration?
Good question. So I'd like to see like 12 more Yolandas. Okay. I mean that. So I mean, there are a lot of providers, there are a lot of resource-rich entities that are in our communities. I can't figure out for the life of me why they're not working in our government. So if you want to see a change, you got to be a change, right? And so if you don't, I worked at Fortune, I worked at WPA, I worked at, all of the places. And so, but the bottom line is that if you really want to see the shift and the change, is why are you not coming into an entity that will give you that opportunity? Right. And so not that Fortune does not give it to you, and not that, the others don't give it to you, but I would like to see more of us as change makers. Right. And so if we can talk about it, then we should be about it. And so I think sometimes it's tedious, and sometimes it's difficult, because sometimes you are working against people who just don't think that you should be doing that. Right. And so I think that if we go into these entities, we can yet understand what is happening on the side of where we talk about the government, right? And so if we are there to help make that change or shift that change or inform that shift, I think that it gives us a great opportunity. We definitely need advocates. We definitely need non-for-profits. We definitely need all of the entities that are supportive. But I also think that we need to have people as change agents, because, Yolanda's not the only change agent. Sarah's not the only change agent. And sometimes I notice, if you want to think about an analogy, sometimes I notice that when we've done something so long, we think we have the answer. right? So I went to Rikers yesterday, and I want to think I'm the professional. I know what's going on here in Rikers. I didn't have a clue, okay, because I haven't been to Rikers since before COVID, and so it's a very different Rikers right now. I'm very proud to say that the work that we have done on both sides is working, because 20 years ago, Allison Jordan is on this thing here. That was one that she used to hit us upside the head and make us learn from her. And so about health, right? About connecting health. But the bottom line is that it was 3,000, 4,000 women, right? It was 118 yesterday, right? So we may not be looking at the fact that that 20 years of work is coming to fruition, but it's more work to be done. And I also must say that the other change is, if you work in this field and you are not in the housing development, or you are not in the doctor's office, or like I got a little something going on right now, and you just, like you said, I can keep on going. So if you a person who doesn't have justice history, kind of pushes it off and puts it to the back burner, imagine a person who has justice history. So I think we need to start looking through a different lens. So that's why I employ IT, right? The capital people who fix the building, the people who are doing the finances, right? I want them to go out to the site. So don't just do the numbers. You worked at the agency how long, and you haven't even been to any of your facilities? Or you might have went to Fortune's Castle one time way back 4 years ago. Come on, go in, speak to individuals, understand what's really happening, because we can't make those decisions. I went to Rikers for a purpose, right? WCJA had me out there. But I don't want to tell you guys, oh, the women are downtrodden and they need to have some ways of picking them up and helping to assist. Could you come to WCJA and be able to help them? And if they need anything from NYCHA, they want to go back with their family, could you tell them about the family? But I want to hear from them what they need. So not everybody can run out to Rikers. I understand that. But if you're about this work, then you should be about the person you're working for. So that's what I wish. I wish that all would come and apply. There's some very interesting positions in the city of New York nowadays. And we have an opportunity. Some of these younger, very smart individuals have some very great opportunities to join. And so the other thing is that please don't sit from your desk and tell me that you can solve poverty. Because I don't know where you guys was in COVID. Because it seemed like they forgot about COVID, Amy. Yes, they did. They forgot that it was COVID and people couldn't eat. And they had to send their kids to school to eat. And so all of a sudden now we forgot about COVID, and we're gonna cure the ills of criminal justice. Really? So I think that it's time for us we've done a lot. We have done a lot. But there's more for us to do. There's more places for us to do it. And many of us sitting on this line join into Freedom Agenda, right? And it's not just because we're friends that I want to know about Freedom Agenda. I don't even understand some of the things that they said about Rikers Island and the air. But guess what? I sit to listen and learn. And so be abreast of what is happening across the focus of what you're working in. Yeah. Right. And if you're not, when you come to these Zooms, write the name down and call the person and say, well, listen, I didn't get that. I want to hear about so-and-so, or I want to join you. Right. The other thing that I don't want y'all to, I get a little pet peeve about. The other thing is that I want people to support. We all get a paycheck on the back of formerly incarcerated people. But very seldom, even the formerly incarcerated people, very seldom do they write a paycheck back. Like being able to, when you talk about support, be about support. So that's just one of the things. I think NYCHA can do a lot. The other thing is, please don't blame NYCHA. And I know NYCHA does some things that maybe they not so proud of sometimes. But remember, it's 11,000 employees. Just like where you work, there's a bunch of employees. Some of them will do something different. Oh, so let me just say this last thing. We are not all the same. We don't all need the same. I don't need supportive housing. I may need the hoarding people. No, I don't need supportive housing. But please understand that your way of doing business is not the only freedom way. the same way that we have to have supportive housing, regular programs, regular substance abuse program. And Jerome said something, I was up here squinting because I can't see either. Different eye doctors. You understand? There's differences. Stop clumping us together and thinking that you have the answer, because you do not. And the other thing, if we don't start to talk about racism, I'm going to leave it there.
Yep. Yeah, thank you for sharing that. So we have a number of questions like in the audience, in the Q&A from the audience. So I'm gonna read at least two of them, and we could go popcorn style, or whoever want to like tackle it and answer it. So the first one, and I think it was Christina who had mentioned something about this, peer support. And it says, how will peers be implemented as workers in the New York City Correctional Services? So that's one question. And the second one is from Allison, who asks, is anyone working on a national level to address the need to consider folks who are incarcerated, especially in local jails, between shelter stays as unhoused? And I know Patricia Hernandez, who's in the chat, had mentioned something to this, like schooled me to this some time ago. But I'll let our panelists like try to tackle any one of those two questions.
So the first question you asked about peers on the inside, what a wonderful idea. So I can tell you what I know about it. I do know that I'm currently on probation, and it's difficult for me to get into these institutions. So that's the first barrier. And a lot of the peers are still on probation or parole. That's a barrier number one. But I do know currently that Exodus Transitional Communities does have a program that does go in on the inside. So I think there are ways around it. I think ideally I would love for my program to have that ability to go on the inside and do that. And I'd love to see more of it, because I can remember, and I can speak from personal experience, being in prison, in federal prison, and having a connections book from like 1999. You know what I mean? With no services, available. And the way that they talked about reentry and the services and the release preparation classes, when I touched the ground, it looked very, very different. Some of those businesses were even closed. So what a wonderful idea. I mean, Fortune and Osborne, they go on the inside. I don't know how many peers that they have on the inside, but I know they've been very successful, like with ICANN and things like that. I would love to be able to do the work from the inside and give them the resources before being released, and not get dropped in New York City and say, now what do I do? I'm going to this place and they're closed.
Yes. Thank you for that. Anyone else want to tackle that question about peers, or the other question about, work on a national level to address, the needs of incarcerated folks, especially like in the local jail, between the shelter system? Because a lot of people, from the prison system in New York State, sometimes like they could have family members like myself. I have family living in Nigeria. I have family living, in New York City. But I decided to go to a transitional housing in order to to not to burden my family members and try to like help myself on my own. But is there any work on a national level around some of the issues that any of y'all are working on a local level?
Well, that family reentry is being duplicated, or has been duplicated across the nation in public housing, right? So HUD, who is our boss, y'all know that, HUD has put out a mandate that you don't use arrest, right, to house people. And so it's fascinating to me. So when it goes to New York and it goes to Arkansas and it goes to South Dakota, it looks very different, right? Because people think of New York City housing only, but really there's public housing across the United States. So people have duplicated this program in their way and made sure that they were able to open their doors to individuals who had justice histories, which they didn't do in the past. So we have mandates from HUD that we have to look at certain things and shift our policies to make sure that we're being fair. That's number one. I'm very proud of them, but that was before that other administration. But Allison has worked on so many different angles of mental health and being able to house individuals. And I think Community for Supportive Housing, I got to shout them out. They're fabulous. And to help us understand where those barriers and those gaps are in doing something across, they definitely are in Pennsylvania and other states, but doing something so that we can collectively bring it together so we can get some shifts in legislation. So I think, and funding, right, in legislation. So I think they're working on it. But I just said to Alexander, because he said, Miss Alexandra, because she said something about lanes, right? It's so many different lanes to play. And so sometimes you don't know which lane to go in. But I think that there's enough space for all of us, right? And sometimes we don't think that we can be able to go over there and do that, right? So I think that once we figure out those lanes and once we have had a lot of traction also with WCJA, with Sharon Harrigan White. She's also working across the United States with women and efforts so that we can take a look at it across the United States. So I think there's some work being done on it, and there's some people that are specializing in it, but I don't know, I can't rattle it off right off the top of my head, but please get in contact with WCJA because that's what they do.
Awesome. Anna, you want to chime in? Jerome?
Yeah, I'm not familiar with any like organized effort to have jail days count or prison days count, but I know that this has been a topic of conversation from way back. You know, I started housing in 2004, and I went through the Fuse project with Corporation for Supportive Housing and several other, right? It was a great experience. And we talked about it then because a lot of our folks that were being referred to us had just come out of jail. And because of that, they didn't qualify for the chronic homelessness categories, which, you know, eliminates half of the opportunities or more. All of the HUD funded housing pretty much for supportive housing requires that you're chronically homeless. So the discussions have been going on for a long, long time. I don't know, you know, how far we've gotten. I know that those HUD requirements are still there and we still are fighting them, and we still, you know, try to find alternate housing for folks who don't meet those very stiff guidelines. If you're in the shelter for 330 days and you leave, you lose because you didn't make that 365. So you got to make that year or the 2 out of 4. And if you don't, then anything with the chronicity attached, you're not eligible for that. So it's unfortunate because being in a shelter is no joy, and people just don't get the supports they need. There are too many people, too little staff, and organizations like ours, I mean, I think we do great work. I think we all do great work, but there's so much work that needs to be done that there's not enough of us right now to do it. And there's not enough housing that's even being developed to even take care of the people that we need to house now, much less all the people that are going to be coming home soon. So it's not only the people that need housing today, it's the people that are going to continuously be coming home. So it is a discussion that we need to keep talking about, but I agree we need to figure something out about, if you're not homeless when you're in jail, what are you? That's not your home. That's somewhere you're forced to be for whatever reason. And when you come out, you're homeless. So why does your homeless number start at the day you're released? Why didn't it start the day you were incarcerated? It's not logical. So it is a discussion we need to keep having. I just want to jump very, very briefly back to the peer issue. I have written probably 4 or 5 contracts in the last year and a half that I've been back at Fortune for the 3rd time. And I've written peers into every single contract because I think that peers have to be in every single service program. Because if you don't hire and implement the skills in the background, that I'm a formerly incarcerated person, I think I bring a lot to the table because I know what it's like. And I can tell you what being homeless looks like because I've been there. So it does matter, that you employ people and that you give people that opportunity and you let them tell you what people need. Because if you've never been there and you've never experienced even coming home and what that looks like, and wondering where are we going to live now that I'm okay, that part's over. Now, where am I going to go now? Where are we going to live? Especially people who come home and they have kids and they want to reunite and we want to help them do that. It's not just about a room. It's about an apartment where they can be a family. So it's a lot of things like that, but there aren't enough of us in the field. There are a lot of people who think they know what it feels like, and not taking anything away from them at all, because, my heart goes out to anybody who does this work. But when you've been there and you've been through it and you know what it feels like, you bring a little extra.
Yeah.
And you can speak to what it really feels like. And I can tell you what that person sitting across from me feels like, because I sat there too. I went to Fortune as a client and now I'm an employee. So I know both sides. I know how it feels. So it is important. And the peer factor, I mean, there's nothing better than employing peers to do the work.
Yes.
And we have to do it.
I'm glad you mentioned that.
I need to add to that though. I not just peers, right? So I have a knee jerk to peers, right? Because you need to add counselors, case managers, executive directors.
Oh, that's what I'm
owners,
saying. All of it.
because we don't have to just be peers. So that's a great start, right?
Yes.
But how many people have opened their doors to really making sure that it's fair, right? So don't do it for us without us. How about that? And so continue to push, continue to pour into people so that they can become somebody that can earn a livable wage. Because $15 doesn't work for New York City. So I think, and then when you have peers and you have a peer program, and that's wonderful, please give them more than $15 an hour, people.
Yes.
I'm just saying.
Yeah, because like one of the things that came to my mind was that there's an actual campaign right now called Treatment Not Jails, where they're advocating for a non-police response to people with mental health crisis and substance abuse challenges, like when they have like a behavior situation when they utilize substance use, and there's a model for it already. I believe it is in Portland called Cahoots, where they have a mental health professional and peers that respond to people who have mental health crisis. And like you said, it shouldn't stop there when it comes to peers. It should be at all levels of programs, services, agencies, and organizations. So, so Jerome, if you want to answer, chime in on any one of those questions. I also had another question for as well that kind of speaks to what Yolanda was saying about people with lived experience in different levels of organizations. So like, how can you, like each of y'all, work with management of your organization to ask those with lived experience, those with lived experience to be like responding to like policies and practices. So yeah, that's another question as well. But if you wanted to chime in, Jerome.
Thank you. The first question I would like to answer is, I put in the chat, I don't know if everybody got the flyers concerning the port line, where I sometimes man the port line to ask clients questions as well as my coworkers. It's from 9 a.m. to 6 p.m., Monday through Friday. And if you leave a message on the weekend, we will certainly get to that. We will answer your question. In terms of staffing, it's kind of difficult because in certain areas, especially in the medical field, I don't think that many people rise to become a director or something like that, because you really have to go to school a lot of years to get into those certain positions. With the best hope, and I've been blessed with that, is to link up with people who actually care. And I think it doesn't matter your title, it doesn't matter how much money you got, the color of your skin. And I don't think it makes no difference. You just have to care. And I think that a lot of our clients, I'm gonna speak for my clients, they've had like a bad break where they've run into people who may not have cared or asked that extra question, or they see them limp into the office and they just because they're not getting treated for the limp, they won't even ask them about the limp. They'll see them squinting, but they won't ask them if they had an eye doctor. You know, it's little things like that. Like I've had a client that had an oxygen tank as long as this desk, and he has a case manager. So I had to order him a portable oxygen tank, something he can carry. So it's just little things that, you know, we pay attention to everything else. We need to pay attention to our clients, and let's get the best outcome for the client. So to double down on that first question, I put the, I'm sure the flyers about the port line have been circulated, but the port line is in the chat as well, and we answer those peer questions. We provide a lot of moral support. There's a lot that goes on there.
Okay. So we're about wrapping it up. We got about 4 minutes left, and I guess each of you can take a minute if you have any like final thoughts. I guess
I have one thought that I just wanted to say on your last question. So I can only speak for the Health Justice Network and the Osborne Association, where I started. I was also a participant and a graduate of the workforce development program there. They then hired me as a community health worker. I was released in March of 2019. I started working as a community health worker in September of 2019. I had no master's degree. I had people that believed in me, and I asked for a chance, and they gave me that chance. I had no degree, but I had lived experience, and I knew what our population needed. And then I was able to grow within the program. So I can say that the Health Justice Network, we practice what we preach. And we lift up people with lived experience with our staff, with our participants.
Awesome. Anna, any thoughts?
I mean, I've learned so much just from being here today, and I really appreciate that from everyone. And that's the bottom line, that we all need to keep learning and keep educating ourselves so that we can help others even more. So that's one of my goals every time I participate in something like this or anything, even attending. It's like, what can I learn today? So I think that, you know, I learned a lot of things about the peer issues and that, and I love, Jerome, I love what you do as a former nurse. I mean, what you do to me is like so valuable, because I remember before I was incarcerated, what I used to do. And now looking back, I remember thinking, now, why don't we have choices for who we want to see for healthcare? Everybody else in the world does, but we come home and then we're told, here's your Medicaid card, here, go see this is your doctor. You don't get to make those choices. So we need to keep fighting, so not only us, but everybody who comes home gets to make the choices for their own lives, and that those choices are not made for them, because they're human beings just like everybody else with the same needs and wants and goals and dreams. And we're here just to help facilitate that, not to tell them and dictate what they need, but to listen to what they need and just maybe provide some guidance here and there. But just, you have to listen to people. And just because you're a formerly incarcerated person doesn't mean you're less than. If anything, it means that you have experiences that can maybe teach others how to appreciate what they have.
Absolutely.
But I appreciate being here today. Thank you so much.
Thank you for being here and sharing a wealth of information. So Jerome, we got about a minute left. Any final thoughts before we go to Yolanda?
My final thought is, though you see me here today, it's a total team effort. It's my coworkers. It's the front desk staff that they take our clients and they schedule them for doctor's appointments with no ID. And we figure it out. It's our supervisors who give us all the tools we need, constantly supporting. And last but not least, when I'm speaking for both hospitals, Bellevue and Kings County. But last but not least, it's the doctors who come through, because we really put our necks on the line. And, you know, sometimes the clients, they be like, you're lying. They don't say it, but they'll be like, come on, you say, for example, just briefly, one of our doctors is out and they've seen a doctor and they had a great experience with him. And I'm like, we have 6 or 12 doctors and they're all the same. They all cut out of the same mindset. And after they go see the doctor, then they understand where we're coming from. So we promote the program. We have full faith in our staff, our doctors, and it works. So I just want to leave everybody with that.
Yeah, thank you for sharing that. And Yolanda?
Yes, I think everybody said it. I just think that, you know, it's not just about we are the ones that are the expert. We are the experts collectively, right? So we are the experts collectively. It's not just about whether you have this or that. Somebody wrote in the chat that she's new. I do suggest that you get an education. Many people are afraid to go get a further education, but education is key. And so even after you get that education, there's a different type of education that you need to deal with individuals who are in our communities. But who you are makes a difference. Right. And so Allison just said it as well. Hire people who care. And when they don't care, how about you move them to somewhere maybe they don't have to deal with individuals and people? Because when you're dealing with people, you're making a paycheck on the back of people. You want to hire people that are inclusive. You know whether or not you like that doctor or that counselor or that whoever, banker. So individuals, they also know, they can feel whether you're being phony, whether you really don't care. All of us make a difference together. I'm not necessarily a subscriber of only criminal justice individuals, but I am a subscriber of people who care. And when you come to the table, don't come with your mouth, come with your heart, because that's what it takes to do this work. It's a little bit more than a regular, driving of the train. I love y'all train drivers, but this is a little bit more. And in order to do this, you got to come with your heart, your head, and your thought process. And again, collectively, we can get this done.
I like that a lot. Come with your heart to the work. So thank you so much, Christina. Thank you so much, Anna. Thank you so much, Jerome. Thank you so much, Yolanda. This was a thought-provoking and informative discussion. And thank you to our audience. Most importantly, thank you to our audience for having.
And I want to give a huge shout out to you too, Darren. Thank you so much for sharing your wisdom and expertise with us today, and to all the panelists. Really enjoyed learning from everybody today. It's been a fabulous panel. Thank you so much for your time and all the work you do. We're looking forward as a consortium to continuing to engage and advocate with you.